Welcome everyone to today's talk on sleep medicine. My name is Dr. Andrew Ng. I'm a respiratory and sleep specialist based in Sydney. I completed my medical degree at Sydney University and my PhD in sleep medicine at New South Wales University. I also lecture for a postgraduate course at the University of Western Australia. In the next 5 minutes, I will show you why sleep medicine is important, why sleep health is essential, and the potential consequences if they are not managed well. This first picture depicts the pinnacle of human endeavour and scientific achievement of the 20th century. Unfortunately, it also demonstrates the severe consequences of unmanaged sleep disorders. I will come back to this shortly. So what is sleep medicine? Well, it's a subspecialty of medicine that includes a range of conditions from sleep disordered breathing, namely snoring and sleep apnea, to also include insomnia, sleep deprivation, shift work sleep disorder, other circadian rhythm disorders, parasomnias, narcolepsy, respiratory failure, and restless leg syndrome, just to name a few. It arose largely through the work of Professor Colin Sullivan, who was often regarded as the father of sleep medicine. His research into sudden infant death syndrome led him to a treatment for sleep apnea, namely CPAP therapy or continuous positive airway pressure, which has saved countless lives. This treatment remains the gold standard and is used extensively in both adults and children. An extension of this is also used for respiratory failure patients, making the iron lung a relic of the past. He is a strong advocate for sleep medicine, both locally and internationally, particularly its wide-ranging effects on both the mind and body of the patient. We thank him for his help in promoting and awarding research awards at My Lucas Research Institute with the Health Minister, in fact in the very suburb in which he was born. Sleep medicine especially came to the fore with the awarding of the Nobel Prize in Physiology or Medicine to three distinguished scientists, Jeffrey C. Hall, Michael Rosbash, and Michael W. Young. In fact, the judging panel displayed their prescience by predicting that circadian rhythm disorders would have their greatest impact on the 21st century, which indeed is looking true to form. So what is the circadian rhythm? Well, let's take a look at this plant. During the day, it is awake, and at night, it is asleep. But what would happen if we took away the external stimulus of sunlight? Well, the plant still knows when it should be awake and when it should be asleep. This is the circadian rhythm, which is an inbuilt 24-hour diurnal clock which is present in virtually all organisms, even down to the cellular level. In Australia, we have looked at the impact of working long hours, shift work, and inadequate sleep in general. A report published in 2017 showed that the cost to the community was estimated to be $66 billion, or roughly 6% of the Australian gross domestic product. This consisted of $26 billion in health system costs, productivity losses, informal care costs, and other costs. Another $40 billion was in loss of well-being from healthy life loss through disability and premature death. In 2019, a federal government report emphasised the importance of sleep health. In particular, the report published 11 recommendations, the first being the 3 pillars of good health, namely fitness, good nutrition, and good sleep. The second recommendation highlighted the need for optimal shift work structures and other workplace practices in order to promote alertness, productivity, and worker safety. This is because sleep deprivation and alcohol can have similar effects. For example, staying awake for 17 hours is the same as having a blood alcohol level of 0.05. And if you extend that to 21 hours, the effect mirrors having a blood alcohol level of 0.08. Also pictured are the Exxon Valdez oil spill, which is probably the worst environmental disaster ever, and the 3 Mile Island nuclear disaster. These disasters are highlighted in an international research paper on 5 OECD countries, namely the US, the UK, Germany, Japan, and Canada. They looked at the economic costs in terms of lost GDP and lower labour productivity. This paper goes on to say insufficient sleep duration has been linked with 7 of the 15 leading causes of death in the United States, which includes cardiovascular disease, cancer, cerebral vascular disease, accidents, diabetes, septicemia, and hypertension. In addition to impairing health and well-being, sleep deprivation also impairs cognitive performance and workplace productivity, which has been linked to the Chernobyl nuclear explosion, the 3 Mile Island nuclear incident, the Exxon Valdez oil spill, and unfortunately, coming back to our first picture, the Space Shuttle Challenger tragedy. So every year we have a World Sleep Day to promote awareness of good sleep health. This year the focus was on better sleep leading to a better life and better health, which leads to better decision making and a better planet. So thank you everyone for your attention. And before I go, I will leave you with one last picture, which again represents another sleep disorder. Have a think about it, and I will explain all in my next video. Bye for now.